Welcome to the Browser 5.0. If you haven't heard, the chin is in. The number of chin plants done by plastic surgeons up 71% in 2011. That makes it the fastest growing procedure in the nation. And women and men are both having the procedure done, especially if they are over the age of 40. So what is causing people to focus more on their jawline? Well, I'm joined by Dr. Stephen Mobley, who is a facial plastic surgeon at the University of Utah. Dr. Mobley, this is something, have we seen this progressing over the last few years, or what's causing this spike?
Probably two phenomena going on, Scott. First of all, economically, people who could maybe pursue cosmetic surgery were on the sidelines when the economy was really down at its lowest nadir. Now that things are turning around, they're feeling a little bit more loose, able to spend that money they may have saved for a cosmetic procedure. That's reason one. Reason two is that if you have a weak chin or a double chin or a weak jawline, a cosmetic chin implant is probably one of the biggest bang for your bucks in terms of a cosmetic procedure. They're not super expensive in the world of cosmetic surgery, and a strong jawline is attractive both on men and women.
So before we get to cost, let's talk about what it entails in terms of a chin implant.
So a chin implant basically can be done with an incision either under the chin, where I'm touching my skin now, or through the mouth. There's two different ways you can get them there. There's different materials. A silastic type plastic is one of the most popular ones. And the chin implant, as you can see on the model here, just rests snug against the bone beneath the natural muscles and skin and gives you that more defined jawline.
And this is the actual implant right here material?
This is the Scott Haas one. It's for a very macho jawline. It's got it's more of a square implant.
So right there.
So men would choose that one more likely than a female.
Right.
This is for someone who just needs a smallest little bump, just a little tiny one there. There you go. Yeah, well, you've got a nice jaw.
Right there.
And here's more of an average one for a female. So I brought sort of a spectrum between larger, small, and average.
Recovery time.
This you need about a week down. You're going to have a dressing on your chin, some visible stitches if we go from the underside. So take about a week off from work to lay low. When you go back to work, your colleagues will barely notice.
Yeah, and not very invasive, again, in terms of the other procedures that you may perform on the face, right?
Exactly. The whole operation can be done through an incision about 1 inch wide. And for what you do in terms of surgical time and recovery, you get a pretty nice cosmetic result.
Here's some before and afters. There's the before on the left, and then the after on the right.
This example also, when combined with a rhinoplasty, how the nose and chin now are just in better balance with each other.
And let's take another before and after right here and show you right here.
So this is a really nice guy. He was in a band, was always bothered by his face looking heavy on stage. We did liposuction, combining it with a chin implant, took away that sort of, what people might call the turkey gobbler, and it give you a much more youthful appearance.
Okay, and the final before and after right there.
Real nice young lady, kind of a standard middle-of-the-road implant, just had a weak chin, and with the chin implant, you can see it just defines the jaw and makes you just look a little bit more with balanced facial features.
Okay, Dr. Mobley, we appreciate it. Basic cost, again, ballpark?
Approximately $3,000, which, while not cheap in the world of cosmetic surgery, is probably on the lower side of costs.
Okay, and I'll keep this one right here. Keep it handy.
The Scott Haas.
All right, thanks.